Well, after the Bayh-Dole Act, NIH began slowly migrating from a scientific research agency to a drug development incubator. And I think in 2016, and I may get these numbers wrong, but I think that year there were about 220 new drugs approved by FDA, and 100% of them came out of NIH. For example, the Moderna vaccine, NIH owns half of that vaccine, 50%. So the billions of dollars that that vaccine makes, half of that goes to NIH, the agency, but there's also individuals, at least 4, and maybe 6 individuals who work for NIH who are high-level deputies under Anthony Fauci who get to collect $150,000 a year forever, not just for their lives, but their children. As long as that mRNA technology is on the market, they're going to be making money from it.
Okay,
and that is a conflict.
Hang on a minute now, because I don't want to blow by this too fast. So the National Institute of Health is getting a kickback, a bribe, a royalty, a share, whatever you want to call it. Is this not a clear conflict of interest?
Yes.
That's what you're pointing out, right?
Yeah, it is. People are shocked.
Why are you the only one talking about this?
If you talk about this kind of thing, you get censored on YouTube. You will not be allowed on the mainstream media to talk about these issues. It used to be that you could, and nowadays you cannot.
If there's some rational reason for it, then why would they try to censor and hide it?
I think it was an idealistic reason. This was, 1980, right? It was the time of the Reagan Revolution. If you put privatized incentives into the government agencies, that they would function better and more efficiently.
Yeah, but it's always the right time to do the right thing. And by the way, they can't get emergency approval for these things if there's a treatment available, you've also pointed out.
The whole approval of the Moderna vaccine and the Pfizer vaccines during COVID required them to suppress any other therapeutic drugs that may have been effective against COVID. And a lot of people believe, including myself, that there were therapeutics that were very, very effective against COVID, like ivermectin, like hydroxychloroquine, famotidine, and many, many others, and that they were deliberately suppressed because the government wanted to issue these emergency use authorizations, and it would have been illegal if they acknowledged that there was an existing drug that was approved for any purpose that was effective against COVID.
It seems to me that that's another conflict of interest, that they have to suppress this to get their payday.